You must have heard about the accident last night.
Yes. His wife. Poor man. What he must be going through. Is she all right?
Well, her condition is stable for the moment, but I'm afraid that Dr. Langtry's in no condition to operate on Chip.
But you said it's necessary.
Yes. Yes, ma'am. Dr. McIntyre's on his way back to the hospital right now. He'll see about getting a replacement for Dr. Langtry.
But what about Chip's arm? I mean, will it get worse? Waiting to operate like this.
Well, I think with a little luck, we should have him back in surgery within 24 hours, and that should be plenty of time.
But who'll do the operating?
We're working on that.
It doesn't seem right, a big hospital like this. There must be someone on your staff.
Microvascular surgery is a relatively new field, Mrs. Begley. It's highly specialized. There aren't too many surgeons around as qualified as Dr. Langtry.
Well, it just isn't fair. This Dr. Langtry, he does this terrible thing. He shoots his wife. Now, I know it's accidental. But why should my son be the victim? Why should Chip lose his arm because of that?
Mrs. Begley, Chip will not lose his arm.
Now, you can't be sure of that, can you, Doctor? You haven't even got a surgeon that can help him.
I promise you, we will find one.
How? Where? The only one that can do the job is too upset to work. But let me tell you something. I'm upset, too. And I'm going to be a lot more upset if something isn't done to help my boy.
No answer from Langtry's home.
Try his club.
I did. I tried them all.
Oh, damn. What about Grossman in Los Angeles?
He's ballooning in France.
Oh, great.
Trevor, what's all this ruckus about the Begley case?
Frank Langtry's got himself all racked up about his wife. He doesn't trust himself to do the operation.
Well, have you talked to him?
Nope.
Why not?
He's not here.
We haven't been able to find him anywhere.
Oh, dear. That's that microvascular stuff, isn't it?
Yeah, exploratory surgery on a forearm replantation for venous obstruction.
Grossman, Los Angeles.
He's ballooning in France.
Ballooning? Oh, what a great idea. You know, I've always wanted...
What about the San Diego area?
For ballooning? I don't think so. I mean, it's much too...
Arnold, we're looking for a surgeon.
Oh, yes, a surgeon. San Diego. Why don't you do the surgery?
Because the boy will probably need a 1 to 2 millimeter vein graft, and I have never worked with vessels that small.
Not many people have.
There is a man down in San Diego named Richmond. We tried to get him on staff last year, but his contractual demands were outrageous. In fact, they were disgusting. We shouldn't even deal with him at all.
I'll find him, Arnold.
There is another man, Cabot. Now, he's much nicer.
Find him, too. We'll check out the Portland area.
Well, I'll do my best. Ballooning, what a romantic way to travel.
All right, take Mrs. Johnson off all medication.
Last time we did that, she wet her bed.
No, that was Mrs. Wyckoff.
Mrs. Wyckoff wet Mrs. Johnson's bed?
Gonzo, Mrs. Langtry spiked a temperature.
Oh, all right.
103, and her dressing's soaked with bile.
She hardly had any drainage this morning.
We better take a look.
Yeah, maybe a biliary fistula. Call X-ray and order an IVC.
Dr. Borg, please. San Francisco calling. Pardon? Oh, dear. I'm sorry. Thank you. Dr. Borg's in prison. Tax fraud.
Richmond and Cabot are unavailable, Trapper, but there is a man named Borg in Portland. He's a delightful fellow. Used to give me wonderful financial advice.
He's moved.
Well, he has where?
Leavenworth.
Really?
Yes? Okay, I'll be right there. I'll try Sacramento, Fresno, and Seattle. I'll be in radiology. Well, what do we got?
Vivian Langtry's IVC.
Oh, boy.
Yeah, look at that. There's dye leaking out of her gallbladder.
We should have got it while we were in there.
Well, it looked viable. There was no way of knowing.
Well, we know now. It's got to come out. How's her condition?
Not too good. She's still running a temperature. Electrolytes are out of whack.
Well, we better let her know. How you doing?
I'm awake, but don't ask me to dance.
Well, as soon as you're ready, I want the first tango, okay? How do you feel, Viv?
Terrible. What's happening to me?
Well, it looks like you got a leaky gallbladder, and we're gonna have to go in there and get it.
Can't I live with a leaky gallbladder? My kitchen sink leaks. We get along all right.
It's leaking poison into your system. I don't think you'll get along too well with that.
Is it an emergency?
Well, the sooner we get it, the sooner we're going to be able to tango our way across the ballroom.
We don't want to wait too long.
Is Frank gonna operate on Chip Begley?
No.
Who is?
Don't know yet.
He should do that operation. He really should.
Hey, you know, we're talking about your operation. We have your consent?
I want Frank to do it, Trapper.
We don't even know where Frank is.
Find him.
It'd be reasonable. You know he's in no condition to do your surgery.
That's exactly why he should do it, to prove he can.
Come on, don't be foolish.
No consent unless my husband operates. That's final.
Open up. It's cold out here. Where have you been? We've been looking all over for you.
Walking, thinking, trying to find some answers.
Any luck?
What's the difference?
Well, now, I am chief of surgery of a very large hospital. I got a lot more important things to do than chase around after you.
What do you want, Trap?
That's all it is. What are you doing?
Changing my lifestyle. Turning these over to the police.
Look, Frank.
No lectures, okay, Trapper? I know why you're here. The answer is no. I can't do the job on Chip Begley. It's as simple as that.
Well, let's forget Chip Begley for the moment. The important thing is Vivian.
What's wrong?
Biliary fistula. Gallbladder's gonna have to come out.
Well, that's a routine procedure. You can do it.
He doesn't want anybody to do it but you.
It's not standard practice for a surgeon to operate on his own wife.
Is, if she insists on it.
Look, just get off my back, will you, Trapper? I almost killed her once already. I can't even treat my own patient. I can't face Vivian. I can't face Chip Begley. I can't even face myself.
Frank, the only reason I'm here is to deliver a message. Vivian will not consent to the surgery unless you do it.
I can't believe that she...
Frank, I don't give a damn what you believe. Now, if you don't believe that your wife is dying, that's your business. And if you don't want to help her, that's your business, too. But you will tell her, Frank, not me. You.
You know that. I haven't done that kind of surgery for years.
It's time you did it again.
I can't take the chance on hurting you again, so please just let Trapper do it, okay? I don't trust myself.
Sorry. So you were nobody.
What are you trying to do, kill yourself?
Boy, are you dumb. I want to live very much, thank you. But I want you alive, too.
You have no right to put your life on the line for me.
Why not? You're my husband.
I'm sorry, babe. You're asking too much. I can't do it.
Okay, don't.
This is crazy. You're acting like a professional martyr.
And you're